Do you treat patients with TMJ? We all do. They all have a right one and a left one. However, some patients not only have two TMJs, they have something called TMD. This is a diagnosis that's gone through a lot of different providers. Rarely will I see someone right off the bat with TMD. Unfortunately, they've gone through their dentist. They've gone through an acupuncturist. They've gone through physical therapy. They've gone through months of rest and hoping it'll go away, or oral splints or mouth guards. When they come into our office, there is one thing that we can do to significantly help direct this care, and that's determine if it's myogynous or arthrogenic. A myogynous TMJ type patient is able to be helped with conservative measures. We can have phenomenal results with these patients. People with arthrogenic TMD, we can still have a good impact on. Unfortunately, once that joint has been disrupted with any kind of osteoarthritis with cartilage problems or a disc problem, they tend to take a little bit longer and they tend to need some co-management. How do you make this differentiation? I use the Crpt test. As you can see right here, I've got 2 fingers behind, 2 fingers below the mandible. I'm going to be bringing their jaw down into a little bit of depression and using some force and forcing that mandible up into the temporal fossa and squishing that joint. When I do that, if there is an arthrogenic pain sensitive structure, unfortunately, that patient falls into that latter category. However, if it does not reproduce their pain, I can be certain we have a myogynous type of TMD. So what can we do for these patients? The first thing we can do is to check out the superior lateral pterygoid. It's a muscle responsible for unlocking the jaw. So for your patients, if you look at them open their jaw, what you'll see is the first 50% of opening should be pure rotation at the TMJ. These patients don't do that though. When they open, they go directly into anterior translation, that temporal fossa, putting the disc and putting those muscles at a huge disadvantage. That's how you can go from doing this motion, a single cheeseburger, to now fitting the whole double cheeseburger in your mouth. That unlocking fashion, we need that. Unfortunately, it creates muscular imbalance. So if we can see here, if that muscle is tight and they're going through that anterior translation, the first 50% of motion, use the soft tissue manipulation to relax and release that superior lateral pterygoid, because the superior band of that superior lateral pterygoid attaches to the capsule and the disc. It's actually pulling all those structures forward and could be the cause of that patient's pain. What you can see from this video is my hand right along the back part of the teeth, and I'm going to separate the distance between the mandible and that temporal fossa. You can also use the head motion since the origin of the muscle is attached to the temporalis. Now, the second part of this is postural correction. A lot of our patients are in this position all day long. We have some convergence at the cervical trigeminal nucleus, and unfortunately, when we have that, you could have some peripheral sensitization. If you have a lot of headaches, a lot of neck pain, it can feed forward over into that jaw. So make sure if you have a TMD patient, you're assessing the neck. Make sure if you have a neck pain patient, you're assessing the jaw, since there is so much carryover. Now for the last part of the video, which is probably my favorite exercise for TMD, and it's not my favorite, it's just the best exercise that we can find in the research that's going to help patients retrain that motion. So after you work on the neck, after you can improve their posture, have the patient say the letter N. In fact, do it yourself. When you say the letter N, the tip of your tongue is going to go to the front part of your mouth. When that happens, you're going to lock your jaw in that position, and you're going to hold your tongue there. You're going to push up into the back part of your teeth, and then open your mouth. If you do that, it's not going to allow that anterior translation of your jaw. So now you are retraining your patient to go through the first 50% of motion of jaw opening without allowing anterior translation. This can help the patient remold that disc, retrain those muscles, and get them to feel a whole bunch better. So I hope these tips help with your next patient with TMD. If you want more information on the orthopedic test that's associated with it, like the CRPT, if you want to actually hear the sound associated with the treatments for the superior lateral pterygoid or the masseter, you can find those in ChiroUp. If you want to deliver those exercises to your patients, you can also do that through emailing, printing, or texting the condition report. Hope this helps with your next patient with TMD.